Hello, and welcome to Season 2 of Health Talk, a show where we discuss topics informed by you, the listener, on health challenges you're facing and providing you with the information to live your best, healthiest life. I'm your host, Dr. Desmar Walks, family physician and Health Authority Medical Director of Austin-Travis County and Austin Public Health. Today's episode will be focused on discussing pediatric immunizations, or pediatric shots, and measles, with a wonderful guest expert who specializes in pediatric infectious diseases. Measles is highly contagious. It's a virus that's spread through the air via a cough or sneezing, or just by an infected person's breath. In fact, it is so contagious that if one person who has measles is in a room where you are, and particularly if you're not vaccinated, the Centers for Disease Control and Prevention, or the CDC, states that up to 9 in 10 of those people who were unvaccinated in that room, exposed to that person with measles, can get measles. In 2023, according to the World Health Organization, globally, that's across the world, 107,500 people died as a result of measles. Many of these deaths were in children who were under the age of 5. And in the United States, 3 people died in the current outbreak that we have that started earlier this year, and 2 of these deaths have been in children. And this outbreak has been named the largest measles outbreak since 2000, when the U.S. declared the disease eliminated. The number of cases in Texas since this outbreak has risen to 753 as of yesterday, July the 1st, and there have been 99 people placed in hospital, and there have been 2 deaths in children. Our guest today is Dr. Donald Murphy, a board-certified practicing pediatric infectious disease specialist here in Austin, Texas. He's worked lending his expertise to the Texas Medical Association, the Texas Pediatric Society, and he's one of the leading experts on child health and infectious disease. Don, in the recent past, was the past chair of the TMA, or the Texas Medical Association's Council on Science and Public Health. Welcome, Dr. Murphy.
Thank you.
Good to have you.
I'm glad to be here.
So I'm going to start by asking, can you explain to our audience what the measles virus is, and talk a little bit about its history in our country and in your practice experience?
I would love to. You've gotten the discussion started here with some background, and I agree with all that. Measles has been around for a long time. It was described by ancient physician back in the 10th century. It's pretty much spread worldwide. Some of the explorers brought it from the New World to the Old World and caused some outbreaks then, but now essentially it's all over the world. It's really infection of people. We don't get it from animals or other places. It's all ourselves spreading from people to people. Back when pediatrics was starting, the British pediatricians were describing these illnesses where you have fever and rash, the classic fever rash illnesses, and measles was the first one. The other name for it is rubeola. So that was 100 years ago. And I think one of the reasons that it's prominent is because it is really so contagious, and it is the most contagious infectious illness that we deal with on a regular basis. Some illnesses you may have mild forms, or maybe even like asymptomatic, where you get an infection but you're not really sick with it. Measles is not like that. Measles, if you get it, you're going to be sick. You may be moderately ill, you may be severely ill, but you're not going to get measles and skate through without some problems. You kind of reference the fact that it can be serious, and if you look back 1850s up through 2000s, there's probably 200 million deaths worldwide due to measles, and prior to recent vaccination efforts in the U.S. and then worldwide, there's probably about 1 million deaths a year. There's been a lot of push from the 60s on to immunize for measles in the U.S., and then in the last 20, 30 years also push to immunize people worldwide, and those numbers have come down. But still, we have people getting measles all around the world. It's still an ongoing problem.
It's interesting that you said initially it was brought from the old world to the new world, and epidemiologically, we're seeing at the department and through epidemiologic tracking nationally that the cases up until recently that we've seen in the U.S. have been predominantly from people who travel outside of the U.S. to places where measles is endemic.
Yes.
Unvaccinated, and bring back with them
that's happening over and over and over.
Yeah.
Sometimes just with 1 or 2 people if it's caught, but I think one of the issues is that we have pockets of people. In general, our vaccine rates are pretty good, but you have pockets of people with low rates of immunization that aren't protected from spread, and then we have this intermittently somebody travels and brings back measles, and then there's risk for that to blossom.
So I just want you to go over again what I kind of mentioned earlier about how is measles spread?
So it is a respiratory viral infection, and you get runny nose, cough, congestion, and there is lots of virus in the nose and in the throat. And so when you sneeze, when you cough, when you breathe, there is virus that is very contagious that spreads directly to people around you. So 2 toddlers playing, those viruses go back and forth very quickly, and us taking care of kids, we get coughed on and we pick up those viruses. So that's kind of normal spread. What is different about measles is also it can linger in the air. So a kid coughs, kids say waiting in the emergency room to be seen, they have measles, they cough, they leave that room, other people come in within an hour or 2 hours, and with no direct contact, they can inhale droplets and aerosol and become infected. And that happens, and that's something that's pretty hard to control.
What are some of the early signs and symptoms of measles that people should be aware of?
So measles is a viral respiratory illness like cold and flu and COVID, but you have lots of congestion, lots of runny nose, lots of cough, and then you also develop some red eyes. The whites of the eyes gets red, and you tend to stay sicker longer, and then you start with fever, and typically you have high fever, and your fever continues, and then you have rash. Often the rash starts on the head, up near the hairline, and then spreads down the body and out to the extremities.
And how long is someone contagious, or how long can they spread measles once they get sick?
So typically people are contagious about 4 days before the start of the rash, which often it's kind of hard to tell that it's measles at that point until 4 days after the onset of the rash. And at that point, we're more likely to think, hey, maybe this is measles. So,
why are young children more susceptible to the disease?
So before we had vaccines, it was often school-age kids because they had more exposure. And after the vaccines started, it shifted to infants and then also to teens. Infants can't get immunized until they're a year old, so they're at higher risk. And they also have more viral exposure. And then teens, they may have had vaccine before, but it may be not quite as effective.
Mm-hmm. And of course, now in an outbreak situation, we've got that baby dose that kids can have at 6 months of age if they're in an outbreak situation or traveling.
So that's good for people to think about.
Yeah.
When this outbreak in West Texas started, I had a lot of people wondering if you have a kid between 6 months and 12 months old, they can get an early dose of MMR vaccine to protect them. If they're traveling overseas, that's a good idea. Or if they're in a setting, like if they were out in West Texas where this outbreak is happening, that's a good idea. If we had local transmission here, that would be a good idea.
Which we don't, thankfully.
Yes.
But it has been in other counties in our state, so it's a good idea to check on that when you're traveling outside of Travis County, correct?
Right, this would be like international travel.
Yeah, and international travel too, yeah. What complications can occur after you've been infected with measles?
So kids with measles are pretty sick. I cared for one kid with measles early in my career who just stayed sick and got dehydrated and had some respiratory difficulties and got hospitalized and then got better. But it's a tougher illness on kids, especially younger kids. So they may have difficulty breathing, they may have difficulty feeding, they may need some help with those. But beyond that, there is also, you can have a bad pneumonia, a bad viral pneumonia, like a really bad bronchitis or like a pneumonia itself, and have difficulty, even more difficulty breathing, need oxygen, need more support of breathing. You can also get encephalitis. There's a couple forms of encephalitis. Within the year after having measles, a few kids can develop encephalitis related to measles virus. And then there's also a more rare form years later of kind of chronic measles virus related encephalitis.
Mm-hmm. I treated someone with that, and it was a slow deterioration and demise. It was tough to watch.
Yeah.
Who else is at risk for experiencing complications if they're infected with measles?
So the people that have the most difficulty with this is infants. Pregnant women can't be immunized with MMR because it's a live virus vaccine, and they are at more risk of complications. And then who I worry about is people with cancer, people who are immune compromised, and they can't fight off measles virus, like kids with leukemia or people that had a bone marrow transplant or people who had a kidney or liver transplant. Some of them are doing fine and their immune system's fairly good. Some of them really don't have a great immune system to fight off a bad viral infection, and they can end up with more severe pneumonia and very difficult viral pneumonia that's not good.
Yeah, and so we have to give them post-exposure treatment with
Gamma globulin. IVIG.
I want to talk a little bit about childhood immunizations or vaccines.
Yeah.
Because there's been a lot of talk in press about the utility and usefulness of that, and I would like us to put the record straight on that. What is the process for creating vaccinations or immunizations?
So let me say I'm a pediatric infectious disease doctor, and my whole career I've been like taking care of kids with infections, but also knowing that there's issues that need to get worked on. And I'm happy to say in my career, my kids got the benefit of multiple immunizations that protected them from getting infections that used to be very common. Kids used to be in the hospital with lots of different infections, and they're not now. And that's a wonderful thing. I think people are anxious about drug companies and big corporations and getting real information. So I hope, like being a Texan and being an Austinite and being a doctor here, that people would say, well, maybe he's a reliable person to listen to. I hope so. You know, I want the best for kids. As a pediatric infectious disease doctor, most of the people that work on developing vaccines are people in my field. A lot of them I know and I have worked with, and in order to get vaccines developed and tested and licensed, you have to do big studies, and I've been involved in vaccine trials in the past, and I trust those people. I like those people.
You know them to be credible and knowledgeable.
Yes, and passionate about
Children.
Trying to improve, trying to protect our kids from having dangerous things happen to them, and make sure that our kids are healthy and don't have, what may be bad events, an illness that could end up hurting our kids and causing long-term damage. So, meningitis and bad pneumonias and bad infections and measles too. Yeah.
And with measles, loss of hearing and visual impairments and problems with learning.
Yes. Encephalitis with measles is going to end up with those things. So
how are vaccinations or immunizations chosen, and how do we decide on how often to give them? Is it not through all of the studies and trials that are done prior to
it is so
released?
It starts with public health. So you need to track and see what diseases what infections are problems in your nation, in your state, and then it takes a bunch of basic science work to say, what causes. So we found measles virus. We know what causes it. And then you have to know, well, if you get measles and you're protected afterwards, what is that protection based on? And it's antibody to proteins on the outside of measles. And then can you make a vaccine that will stimulate that protection, that immunity, without causing the disease? And then you take those candidate vaccines and you try them, make sure that they're safe, and then you have to do studies to show that it is safe and effective in a big group of kids, and then apply for licensure. And then even after they're licensed and out in use, you still monitor for the safety of vaccines, and you watch for any pattern that would suggest there's an safety issue with the vaccine. And we've been doing all those things. It takes decades to do all that. But I think the U.S. has been a center of vaccine development. We should be very proud of all of our scientists, public health people, doctors that have been involved in those activities for decades.
And in fact, in the year 2000, measles was declared eradicated due to the efforts clinically to get children vaccinated. And we tracked for years, for decades, that with the institution of vaccinations, we had eradicated this problem. So when is the ideal time for someone to receive a vaccine for measles?
So most vaccines, we give them 2, 4, 6 months, and then boosters later. With measles, it's a live virus vaccine, and your mom has antibody to measles that she passes to you. So as an infant, you have these antibodies that will block measles vaccine. So we need to wait until mom's antibodies have gone away, and reliably that's at about a year. So typically we give first dose of MMR vaccine, that's the measles vaccine, measles, mumps, rubella, at 12 to 15 months. And we can give it earlier, 6 to 12 months, but we don't count that dose. So if you were traveling somewhere where there was measles with a 6 to 12-month-old, you give them a dose of measles vaccine to help protect them, but you wouldn't count it later on to be one of their regular doses. We relied on just one dose of MMR vaccine for 20 years. And then we saw that it wasn't complete protection, that there was still some measles that was coming in, and so we added a second dose of MMR vaccine, and then the protection goes up to above 95%.
97%, yeah.
And if you stay above 95%, you have herd immunity, and really, we have been in pretty good shape as far as preventing measles. And if you stay above 95% immunity in your community, then typically we are okay.
And unfortunately, that's dropped a little bit for us here in Travis County, but we're making strides thanks to community response and getting that back up. Measles is a vaccine-preventable illness, disease, just like mumps and pertussis and all of those things we have childhood vaccinations for. So what advice do you give to the parents of children that you see with regards to getting their child immunized against these diseases?
So, I try to see if anybody has questions, and a lot of people have questions. If my toaster doesn't work, I Google broken toaster, but I think my toaster fixing skills are not great. People are searching for information, and they find lots of opinions, and they have questions. And what I can say is, I have two kids. They are both fully immunized. Some of the vaccines they got were relatively new at the time, and I'm glad they got them, because now, years later, we know that those vaccines have been very successful in preventing, meningitis and pneumonia. We even have a vaccine that prevents cancer, HPV vaccine. We've had just some tremendous improvements in our health and our protection of health. So I try to talk to people, answer any questions they have, try to talk about science if that helps, but also say, I've known this stuff, I've worked with this stuff my whole life, and I am an enthusiastic supporter of giving kids their vaccines, giving them on the normal schedule, and being confident that we know that's safe. Millions and millions of kids have been immunized on normal schedule, and they're doing great.
And we've prevented a lot of really bad diseases.
We have.
Yeah.
And you can go other places where they don't get them and see that they can get some very bad problems. I think when vaccines work, what happens is we don't see anything. It's like peace and quiet.
Right.
But when we don't vaccinate, then there's problems.
Yes. So we know that we declared an outbreak of measles here in West Texas, and outbreaks are defined as more than three or more cases of a disease that occurs in people that are not linked to one another. They don't live in the same household. And as we talked about, this outbreak in Texas happened after we had eradicated measles 25 years ago in a population of people who were not adequately vaccinated. They didn't have that herd immunity. And so you talked a little bit about that immunity needing to be above 95%. And so are you saying 2 doses of MMR is what brings people to that level of immunity? Yes?
Yeah, so I think when people talk about vaccines, they often think about their own personal situation. But when you're trying to protect, your daycare, your school, your nursing home, your hospital, any big group, really you want to know that the people around you are protected from that illness. And measles is kind of the canary in the coal mine. It's so contagious that it's kind of the first thing we see when our protection has dropped down below what's needed. So that for measles, 95% is what we need. And you can look around Texas at schools or zip codes or areas and see, in general, our rates are pretty good, but there's pockets where the rates are low. People are just anxious about the risk benefits of vaccine. Is it really necessary? Those rates drop down, and now we are seeing measles pop up, and
Whooping cough.
and whooping cough too. Yes,
Yeah.
so we've had epidemics of whooping cough in Texas. You know, if you think about pregnant women, maybe 10 years ago, were on a push to cocoon their babies, make sure everybody in the family around them was immunized against whooping cough, and we did better, and those kids were protected. I've taken care of a lot of whooping cough in kids and some infants with horrible whooping cough that did not survive, and I was really happy to see the cocooning. There's still cocooning going on. It's a great idea. But sometimes we don't hear about something and we think it's gone away. But with infections, they don't go away.
They just wait for opportunities.
Right.
Yeah. What advice would you give to someone who's been in contact with another person who has measles, but the person in question is vaccinated?
So I would say you're okay.
Yes, but we do want you to monitor for symptoms because, as you said, sometimes you may develop symptoms, right?
Yes. And we have different criteria for are you immune to measles. You know, were you born before 57? If you're not sure, have you had 2 MMRs, you can go get another MMR. It's safe to get an extra dose. And then if you're still not sure, you can do a measles antibody, get it checked, and if it's positive, then you're okay. Or if you actually had measles, nobody, hardly anybody, but when I was young, you could say, well, I had measles, so I know I'm immune. So we have criteria for who actually is immune to measles, but for most people it's 2 MMRs. Knowing that you had 2 MMRs, you can feel comfortable, you're protected, but still you would watch for after exposure.
What factors in healthcare prevent individuals and families from getting the vaccine?
So I think of this sort of as our vaccine exemptions. We have medical exemptions that are really important. And there's kids who are immune compromised, have cancer, are on treatment, have had a stem cell transplant, have had a solid organ transplant, kidney transplant, liver transplant. They can't get MMR vaccine. It's a live virus vaccine. It's not safe. They can't do it. Then we have some religious exemptions. And people say, my religion doesn't believe in the vaccine. From what I know, actually, if you ask the leaders of major religions, none of them are opposed to immunizations. And in general, they're supportive of public health and immunization. And then you have the personal belief exemptions. And that is where we have seen kind of a growth of dropping below our 95 percentile down to where there's not herd immunity. A lot of that's personal exemptions, and I have concerns about that. I think we need to think long and hard about, people need to have freedom and personal choice and autonomy, but we also need to think about how that impacts the community and if it threatens other people in your community, kids in your community. If there's a kid in your school who had leukemia or had a transplant, then I think that kid needs some protection.
Love thy neighbor.
Yes.
What are the costs associated with getting the vaccine?
So in general, it's covered by insurance. It's preventative care. It should be covered. It's covered under Obamacare. And then also for kids, there's the VFC, Vaccines for Children program through federal government and through CDC that supplies vaccines to providers who immunize under-immunized kids or kids with funding issues.
And you can come to Austin Public Health to Shots for Tots or Big Shots.
Exactly.
But we have lots of VSC providers and adult safety net providers in our community too.
Yeah, so adults would be like federally qualified health centers and adult immunization program. Also, people can go to the pharmacy now and get
vaccinated.
Shots. Oh yeah, a lot of times.
As long as they're over 14.
Yeah.
Are there any specific considerations for people living in rural or remote communities with limited access to healthcare resources when receiving the vaccine or receiving care?
I think there's definitely access to care issues. I think that's one of our big questions, big problems in healthcare. The rural communities may have lots of uninsured people, may have difficulty. Hospitals and clinics may have financial difficulties. Providers, doctors, nurse practitioners are more likely to work in big cities. And I think we need to try to work on those issues, but they're not easy ones.
Yeah. Are there medicines or therapies being developed that can be taken if someone is infected with measles?
Yeah, so we have Tamiflu for flu, and we have medicines for COVID, but we don't have any antivirals for measles that really work well. None of them are approved. None of them have been effective consistently. We do give kids who are hospitalized with measles, we give them 2 doses of vitamin A, because we know in the developing world, kids who have vitamin A deficiency and get measles can have more severe disease. But giving vitamin A is not a preventative for measles.
Nor a real treatment either.
It's not no, it's just trying to get rid of a risk factor for more severe disease. It's not treatment specifically for measles. And if you take too much vitamin A, if people go crazy with vitamin A, it is toxic in
to the
large
liver.
amounts. Yes,
yeah.
It's not good.
Yeah, not good. Well, I really want to thank you, Dr. Murphy, for being with us today. Your expertise is so valued and such a big part of why we're doing well in this community. So thank you for your expertise. Do you have any resources or books that you can recommend to our audience to learn more about childhood vaccinations? Or
so American Academy of Pediatrics has a very nice website that has lots of really good resources developed by their own pediatricians. All the pediatricians in the U.S., most of them get together and work with AAP on doing educational things. That's a good spot to go. CDC has a good spot to go. There's a doctor in my field in Philadelphia named Paul Offit, who's written a lot about vaccines and has a vaccine safety promotion site there. So you can look up Paul Offit.
How do you spell his last name?
Offit.
Okay, thank you. Well, that's all the time we have for today's episode of Health Talk. A big thank you to our guest, Dr. Murphy, for sharing his expertise and experience with us. And don't forget, we want to hear from you, so what topics do you want to know more about? There's a survey on KEZI's website and on KEZI's Facebook page. So tell us what resonates with you so we can share your feedback and get those questions answered. Thanks again to KAZI 88.7 on your dial and St. David's Foundation for their support of this program. Until next time, take care of yourselves and each other. This is Dr. Desmar Walks signing out. Be well.